Hello, my name is Sung Go from Catholic University of Korea. My corresponding author is Professor Tae-jun Song from Seoul Asan Medical Center. I am honored to share our study entitled Impact of Suprapapillary Method on Patency in Distal Malignant Biliary Obstruction. This is the first randomized multicenter trial which demonstrated the efficacy and safety of the suprapapillary method. Firstly, let me explain the background of this study. Melastans are commonly used for biliary drainage in patients with distal malignant biliary obstruction. However, one of the major concerns of the melastat is the development of duodenal-biliary reflux, which can lead to stent dysfunction, especially when they are placed across the major papilla. Therefore, placing the melastans above the papilla, so-called suprapapillary method, has emerged as a potential solution. Previous studies have reported promising outcomes on suprapapillary method. However, all those studies were retrospective design. Therefore, we conducted a randomized trial to investigate the efficacy and safety of the suprapapillary method. This is the study protocol. 84 patients with unresectable MBO from 6 centers in Korea were enrolled, and they were evenly assigned to either the suprapapillary method or transpapillary method. Considering the adequate drainage of bile juice from the suprapapillary stenting, only cases where the sufficient length of the normal bile duct more than 2 cm from papilla and hepatic hilum were eligible for this study. The primary outcome was stent patency, which was defined as the time interval from the procedure to the occurrence of stent dysfunction. When you also evaluated causes of stent dysfunction, reintervention method, and adverse event rate. For total patient, the most common diagnosis was pancreatic cancer, and more than half of patients had previously biliary stenting. In terms of adverse events, although the difference was not significant, more adverse events were occurred in transpapillary group, including 4 patients with pancreatitis and 1 with cholangitis. This is the result of the primary outcome. The suprapapillary method showed significantly longer patency. The median patency for suprapapillary method was 369 days. However, it was only 154 days for transpapillary method. The causes of stent dysfunction were different between two groups. In transpapillary method, reflux was the most common cause of stent dysfunction. However, it was the rarest cause in suprapapillary group. Although we demonstrated the superior patency of the suprapapillary stenting, it may not be suitable for all cases. To ensure the adequate drainage of the bile juice after suprapapillary stenting, it should be performed for cases where the distance between the major duodenal papilla and the biliary obstruction is greater than 2 cm. The major limitation of our study was a relatively small number of patients due to the narrow range of the inclusion criteria. Also, the majority of the participants had a history of previous sphincterotomy, EST, suggesting that the functionality of the sphincter of Oddi might have been compromised for those patients. To date, a few studies have assessed the safety and efficacy of the EST for suprapapillary stenting, yielding different findings. It should be noted that, although not reported in the manuscript, the patient in the suprapapillary group had a longer patency even after undergoing EST. In this study, minimal EST was performed to facilitate the passage of the metastat for patients with naive papilla. We think that EST may facilitate easier stent removal during reintervention and reduce the burden on the major papilla, thereby potentially minimizing the procedure-related adverse event like pancreatitis. And moreover, minimal EST may maintain adequate biliary drainage without completely compromising sphincter function. However, EST should be performed minimally, considering that the primary purpose of the suprapapillary method, namely the prevention of the reflux. And therefore, in the future, a larger number of patients, specifically those with a naive papilla, are warranted. I would like to thank to the colleagues who contributed to this study and to the listeners. Thank you for taking your time to watch this video.